For over 40 years, Concerned Friends has been advocating for quality and safety in long-term care. We are independent of government, a charitable organization whose mission is to ensure that all residents have access to services that meet their diverse mental health, medical, social, and emotional needs, and where every person has a voice that is heard and rights that are respected. We monitor all inspection reports. At times, our work has been very light. We provide support and guidance to residents and families seeking long-term care, and we've made several submissions to government on proposed legislation and regulations in long-term care. Concerned Friends is vehemently opposed to Bill 7 and requests its immediate withdrawal. Consent is a cornerstone of our democratic society. It is enshrined in Canada's Charter of Rights and Freedoms. It is fundamental to the Nuremberg Code. No research upon a human being without informed consent. It is embedded in our healthcare laws. There is a right to informed consent and to say no. Equal rights and benefits of the law without discrimination is another bedrock of our democratic society. Again, it is set out in the Charter of Rights, international conventions to which Canada is a signatory, healthcare and human rights legislation, and the Residents' Bill of Rights. Equal rights and benefit of the law without discrimination based on age or disability. The old adage, a society is judged by how it treats its most vulnerable, is very relevant. Residents in long-term care are vulnerable. They need our protection to ensure health, safety, and quality. The decimation, I'm going to change my page here. Oops. Am I still on? I seem to have done something. Okay, just one second. If you'll bear with me. The decimation of residents in long care during COVID-19 was abhorrent. We need to protect our most vulnerable. Concerned Friends is vigorously opposed to Bill 7 for three basic reasons. It deprives alternate level of care patients of their fundamental rights to autonomy. Autonomy is the right to choose where you live. Autonomy is the right to be near to your family. Autonomy is the right to choose a safe home. And it deprives ALC patients of their right to consent to assessment, sharing of personal health information, and most important, to their placement in a long-term care facility. I have worked for many decades in the field of healthcare, and I have never seen such an abrogation of rights. Bill 7 is silent on what happens if an ALC patient refuses to go to a long-term home. Will there be extreme fees, as others have mentioned before me? Will there be extreme coercion that is hard to say no to? Will patients be discharged? The bill is silent. There is reference to some directives to be published. Well, they're not present here, and it's entirely frightening. The second reason we're opposed to the bill is it discriminates, as eloquently said by those before me, against seniors and the disabled. This is contrary to the Charter of Rights and Freedoms, human rights legislation, UN conventions, and the Resident Bill of Rights. It flies in the face of decades of laws, and Ontario has been a leader in consent. And these laws require consent to treatment and to personal care, which includes admission to long-term care. Thirdly, this bill puts the health and safety of ALC patients and resident long-term care homes at risk. It shifts a problem in acute care hospitals, and there are problems. There are problems in the healthcare sector, a problem that's multifaceted, but it shifts this problem onto those who have difficulty speaking for themselves. The long-term care sector, as we know from COVID-19, decades of reports I tried to find the Long-Term Care Commission report online and found it had been archived, as well as interim recommendations for what government should do. It forces the problem onto a sector which, as people have indicated, is under-resourced, understaffed, and it forces people to go to homes they don't want. You want to go to a good home. You want to go to a home that is near family. You want to go to a home that has a good safety record. As Advocacy Center for Elderly has written, the homes do not have long wait. The homes that do not have long wait lists are those to which people do not want to go because it does not meet their quality or safety concerns or meet their social needs or religious needs. Bill 7, in our view, must be withdrawn. Thank you.